All right. We should be able to get started. I think it's going to be just us three for tonight. So, continuing with the category of performance enhancement, and then the subtopic being core stability this week. So, the way that my brain works and the way that I kind of separate out like core stability, core training, is to first know the core anatomy. And I think that we should all know at this point that core is not just your abs. I think that that's still a pretty popular misconception. When people think of core strength, they think of, oh, you have to have a ripped six pack. And it's like, okay, well, some of the best core strength on the planet is covered up by 40% of body fat because they're just massive power lifters that are not very lean, so their abs don't show. So not just the abs, and it's also not just the aesthetics, but knowing the true core anatomy, and we'll break that down in a little bit, but knowing the true core anatomy and what all that entails will help guide your approach in your rehabs. The multi-directional application as well. So knowing that it's not just the abs, then you know that you have to train the muscles in different directions. So breaking down kind of which muscles are going to move you in different directions, and then break that down into a further separation of what the book Anatomy Trains calls the slings, or the different trains, if you will. And so all these myofascial meridians are kind of showing how the muscles are working together to create movement in different planes. So we'll go through that a little bit. And then talking about the difference between productive versus resistive strength. And so this is the common terminology here would be like flexion and anti-flexion, or rotation, anti-rotation, things like that. And then lastly will be the application to sport. And so really talking about the details of how you take the earlier stages in a rehab for core strength and apply it to a broader context. So the core anatomy, again, I think that this picture really does justice because you can really see how busy the core really is, both in terms of anterior to posterior. You've got a lot of depth of muscle. Even on the right side, if you just look at the depth of the abdominal wall, all the different oblique muscles that are there, there's so many different tissues that are there. And so to oversimplify it to the core, to just the abs, is missing so much context and nuance. So you can see the different angles of the musculature and the movements that they'll create. So for example, the psoas coming up at a bit of a diagonal is going to lead to some of that hip flexion, but also a little bit of hip abduction or adduction, as opposed to just straight linear hip flexion like you would get from the rectus abdominis. And then talking about like transversus abdominis's role in stabilizing the core, especially for anti-rotational movements. But yeah, so breaking down the components of the anatomy, you've got the abs, so you've got your rectus abdominis, transverse abdominis, and then you've got your internal and external obliques. Those are pretty commonly known, and I think most people train those. For the back, this is where you start to get a little bit less common. The erector spinae is easily taken care of in any kind of a torso extension movement. You're also going to get some of it when you're doing things like hip extension movements. So things like deadlift, you're going to always get activation of the erector spinae. But then also you've got the quadratus lumborum that produces a little bit of movement and also assists a little bit in stability and the anti-rotation component. You've got the pelvic floor, which isn't really shown here, and there's a whole host of muscles there. We won't get into the weeds with how many different muscles are down there. There are people that commit their whole life to it and their whole profession to learning the pelvic floor. So even they are learning new things as they work through their field. So I won't attempt to be a pelvic floor expert. And then similarly, the diaphragm definitely plays a big role in core stability. So breathing is a big component in a lot of technical exercises. So things like the deadlift, making sure that you're bracing with your core, doing the diaphragmatic breathing to really create that intra-abdominal pressure, as opposed to what a lot of people will cue through the breathing of the exercise. So making sure that you're breathing. It's like, okay, no, you don't want to breathe during a heavy deadlift. You're definitely going to hurt yourself, because if you don't have that intra-abdominal pressure, then you've got so much movement happening at the spine that you're probably going to herniate a disc. And then lastly, the hip component. So the lateral aspect is definitely going to give you some lumbopelvic stability. And then also like I said, the iliopsoas plays a role in that as well. So having hip stability that leads to the core, the bottom portion of your core stability. Some people will take it as far up to the C-spine. I tend to refer to it as like the lumbopelvic complex and the stability there. But some people do refer to the core as being anything that's related to spinal stiffness and spinal stability. So there's not a clear consensus on where that starts and stops, but for practical purposes, I think that it makes sense to do the lumbopelvic, which would include anything that's spanning the hip joint, and then also leading up to the thoracic spine. Questions, comments, anything from this so far? We're all anatomy wizards. So knowing the multidirectional musculature will help you to kind of think your way through this process if it's not already just an instinct for you. But so knowing that you have spinal flexion as an option, for example, which muscles are going to contribute to this? Well, you're probably obviously going to guess rectus abdominis. That's the most obvious one, right? But having the psoas involved is definitely going to get you some lumbar spinal flexion. So knowing the musculature that's going to contribute and also get trained by different body movements. So for example, if I have let's say somebody who's got a hip flexor injury, I can also train spinal flexion by just doing a restricted or an isometric for hip flexion. So keep the hip in a neutral position, but then have the core sit up, have the shoulders raise up off the floor. You're going to get that rectus abdominis contribution without taxing the injured body part of the hip flexor. Or conversely, you could also do it the opposite direction. So if they've got some kind of a abdominal hernia that you want to avoid, you can probably minimize the abdominal contribution to the movement and just isolate the hip to train a little bit of that spinal flexion if you're getting the psoas involved. Obviously, depending on your lever lengths there, if you're going really long lever, you're going to get engagement from the recfem or from the rectus abdominis because it's going to help assist with that movement with bracing so that you can move the extremity. But if you keep it a relatively short lever length, then you should be able to isolate a little bit better. So be aware of your lever lengths when you're trying to either target a muscle or trying to avoid activation of a muscle. And so then this will play into every plane that the body can move through. And so the spine can obviously go through flexion and extension. That's bending and extending. But then you also have your lateral flexion. And so that's either direction, either side. You've got your rotation, or some people will call it axial twisting. And so you've got the twisting that's happening at the different vertebrae, and then depending on the facet joint, the angles, you can either have more flexion or more rotation. And so if you've got a flatter facet joint, you're going to have a lot more success with the rotation. Whereas if you have a more vertical facet joint, then you're going to have a more flexion extension bias. So there's varying degrees of not only like within the vertebra. So if you've got, let's just say lumbar, obviously is going to have a more vertical. You're going to get a lot of flexion extension in through the lumbar facets. Whereas if you're in through the thoracic, you're going to get a little bit more horizontal, and you're going to get a little bit more rotational component there. And this varies joint by joint as well. Like it's not just every lumbar facet is vertical, every thoracic joint is horizontal. You're going to get varying degrees where it's slightly horizontal, but it's also got a little bit of vertical. And this is how the spine moves through. It's not just a this or this. It's a combination of directional diagonal movements. And so that's something that I think is important to keep in mind if you're taking somebody through a rehab. And then lastly, like I said, the segmentation. So being able to control each individual vertebrae as you're moving through. I forget the guy's name off the top of my head. It's I think it's Swole Sam or Sam Swole. He's got a pretty big following, and he talks about segmentation all the time. He'll take his patients through a really targeted or isolation rehab. So if he's doing something like a cat-cow, he's telling them he's touching a vertebra and saying, okay, now extend here. and then he'll go up one. Okay, now extend here. And so it's a sequence of contracting the really small musculature in the spine and having really good postural awareness of what's happening at every level of the spine. That's something that we should be able to do, but at the same time, like when you're getting into more functional movements, like you're probably not going to think about it. Questions, comments there? Cool.
No questions. But that part of like the segmentation's kind of like interesting. I'm working with an athlete that just got a lift and L5 and S1, so I'm curious to see how that's gonna look for her. I'm gonna try that when I see her next. And see
Yeah, so I think like early on, you want to limit that movement because it's just going to flare her up, right? So you're going to cause more pain if you're activating that specific area. But if you can train core stability in through that range or that series of vertebrae, then you can also start to create mobility throughout the rest of the spine. So stabilize the painful joints and then start to mobilize the non-painful joints. That should help to kind of expedite that process.
Right. I mean, I'm not going to see her until she's back from the summer.
Right.
But yeah.
Yeah, so that's something you can play with. Definitely check out Sam's stuff. Like I said, I don't remember his like username right off the top of my head. It's like Swole Sam or Sam Swole, something like that. But I'll send it to you.
Sounds good.
And then the hot topic in the strength and conditioning world in the last few years is whether or not you should train anti-flexion or anti-rotation. There's some people, there seems to be two camps where you're either definitively yes or definitively no in terms of training it. But I think the answer, like most things, is probably it depends. And it depends on the athlete you're working with. It depends on their symptomology. It depends on their sport. There's all these different demands and individualization. Like some people need more mobility and some people don't. Some people can get away with just being really rigid. But knowing the difference between, are you actively producing force and trying to rotate, or are you trying to resist a force that's being imposed upon you? So for example, this is really only showing the anti-rotation components, and it's doing it through a stable kneeling position first and progressing it up to a standing position. But you could easily, so if you have the band out to the side, you could produce the force and create rotation by moving through this transverse plane of movement. Or you can just extend your arms, in which case you're creating a longer moment arm, and then that is creating a longer lever for force, which is then going to naturally pull you harder or create more force that you have to resist. So then it's teaching you to kind of progressively increase your force production as you're going through the longer lever arms. I've seen this trained a few different ways. I've seen people do it really slow and steady because it's really teaching the body to kind of progressively kind of, I guess, like rate code how much force you're producing. Or I've seen it done with speed, in which case you create a really rapid change in the moment arm, which spikes the force, and then you have to respond to that. So I think both have their values. I think that early on, I would probably start with slow and controlled to make sure that they understand what muscles are actually engaging and contracting, and then also make sure that they're feeling it where they should. And then from there, you can progress it up to be more resistive for the more rapid extension of the arms. But this is just one, like the powerlift press isn't a magic exercise. It's just one exercise where you create a long moment arm with long resistance. And then it's trying to, the longer your arms are, it's adding more force that you have to resist because it's trying to pull you back. But you can apply this to pretty much any core exercise. So if you're doing a sit-up, for example, extending your arms out overhead, or if you're doing like a V-sit, extending your legs out obviously makes it harder than if your knees are bent. So having those longer arms, lever arms, are going to create more force that you then have to challenge yourself to resist. If you extend your legs out and your legs just fall to the floor, that's not core stability, that's weakness. So making sure that you actually have the ability to resist those forces seems to be important. But I heard recently there was Stuart McMillan was on the Andrew Huberman podcast, and he was going on a rant, basically saying like, why would you want to get rid of rotation when it creates so much momentum and it creates so much force if you're trying to be athletic? He's very big about, this is from Altus, but they're really big about shapes and producing these big shapes. So in order to create arm movement and swing, and same thing with your hips, you have to have rotation of the spine, because otherwise your shoulders are too rigid and you get smaller movements. So by limiting rotation and by being very rigid in your training, you're going to limit how much they can rotate when it comes time to go out and perform. So some people think that you should train kind of like excessive rotation, but then have the ability to still move freely through a full range of motion. Questions, comments, experience with any of that?
Payloft press is probably one of the most common PT exercises that we do. And I've been trying to learn more about the time and place to focus on more pure rotation versus anti-rotation. And I agree with you. I think it definitely depends on exactly what your goals are in PT or in rehab. I see like a lot of older golfers, and I think just from like experience and watching other therapists around me, just about everyone would benefit from more core stability. So we kind of just default to like a payloft press. But, you know, after this slide and we're thinking about it more, it's like, especially if you got a golfer, wouldn't it make more sense for them to produce force through like a rotational movement? And yeah, I think it's confusing because it's like, I definitely want them to have some stability, but I also want them to be able to produce force through that movement. And so I guess it's just like a time and place, but it's something I've been thinking about.
Yeah, I'm not an expert there. Definitely not with golfers. I mean, I play golf, so I understand the demands of it, but I'm not a force expert. I don't know all like the moment arms and everything like that with golf. I think it's called TPI. Has like a rehab specific to like golf swings, but they talk a decent amount about like the different forces of the backswing versus the downswing. So check them out if you're interested in like the golf application. Sally, were you going to say something?
I think it's more of like a combination of both. I know here where I work at, we have like a lumbar spine progression, and it's more of like exercises. It's a progression into the dead bob. So like that's where we're starting. We're starting with pelvic tilts, using the arms, then we're adding the legs, and we're just adding kind of like that focus on core engagement to then progress you to other exercises. But at the same time, we're having you do kind of like a open book, which is kind of like rotation and thoracic mobility and stuff. But at the same time, like you're thinking about golfers, but think about if I'm a basketball player, I'm doing a Euro step, I need to be able to rotate. I need to be able to stabilize myself. If I'm a soccer player, I need to be able to rotate my torso, be engaged to be able to like have a good kick. Because how we were saying about anatomy, it's not just the one muscles that we know, like hip flexor, low back, and all the other muscles that play into it. So I think it is a combination of both, in my opinion.
How would you guys feel about training rotation and anti-rotation in the same session? Do you think it'd be something to focus one at a time, or do you think doing the same thing in the session would make sense? I really don't know.
Sally, you want to take a stab at it?
I think it would depend on like what you want to achieve. Because like at the beginning, like let's say we're starting a rehab from acute, right? You don't want to do any rotation yet, but you need to work on stabilizing in neutral position, right? So you start there, and then once you're able to continue to add more into rotation and whatever, then you progress into that. Does that make sense? That would be how I would do it, because that's how we would do it. Like the lumbar spine progression, we started in neutral, and then we're adding more movement so that you continue to want to engage on your core, but also your body continues to be in different motions. I don't know if that's answering what Dylan. So.
Yeah, I think that makes a lot of sense. If you had someone that was totally healthy in a pure like strength and conditioning for athletic development standpoint, do you think it makes sense to do like a Pallof press and then another exercise followed by that with like a pure rotational aspect?
Kind of like a Russian twist.
Exactly. After we just trained like anti-rotation, do you want to train rotation after that, or do you think it kind of like muddies the water?
I think that goes more into like the strength and conditioning portion, but taking it from like my workouts, I want to say maybe if I do a pull-off exercise, I'll do it on one day and then the other day I'll do Russian twist, or in this block I have the pull-off and then on the bottom block is when I have the Russian twist. I can't remember off the top of my head if I've done that in the same workout, but if I have, it hasn't been in the same block, if that makes sense. It's been separate.
I think that makes more sense.
Matt, I don't know if
I don't
you
know.
different.
Yeah, I don't know. I've been thinking this whole time that you've been talking, and I there's some interesting. I don't know if it's clear scientifically. I don't know if that's something that's been researched. I would doubt it. But there's some kind of counterintuitive pairings within the same block for things like the French contrast, where you squat really heavy and then you go jump like with band assisted. So you're going through really fast over speed training with really slow, heavy resisted training. So I don't know. My intuition tells me that you're defeating the purpose, because if you're going to do, let's say you're going to train anti-rotation first. Now you're creating a rigid spine and you're creating stiffness. To then go train strength, you're going to go through a decreased range of motion. So to me, that defeats the purpose of that. Like, we want to train strength through a full range of motion to be able to express it. And if you go the opposite direction, if you train strength first, I suppose maybe that could be like an activation leading into an anti-rotation exercise. But at the same time, if you're trying to create strength through the range of motion and then you're going to go train stiffness and lack of range of motion, I don't know. I've got conflicting thoughts going on in my head. So I don't know definitively. I don't know if there's research to back that up. That'd be something I'd have to check on.
Good talk.
So then the translation to sports. So this is where we kind of bring everything full circle. And so talking about the different musculature that we're using, talking about how we're activating it through different planes of movement. And then we're considering the different fascial slings. If you've read the book Anatomy Trains, I'm pretty fond of it. I don't use it as the main takeaway or the main intention of the book, which was like the different fascial connections and how you can train fascia, which we obviously know now is like not a thing. Fascia just adapts to the things that we do. But the different lines of musculature that work synergistically is really fascinating to me. So for example, how your feet are influencing things way up to the back of your neck, how your hip flexors are going to affect your head position, things like that. And especially when you look into these more functional patterns, the end stages, where you've got like the rotational or spiral components of the lines, you get some really interesting effects where you get some crossover through, for example, left foot to right arm, like a throw, or in soccer, a left leg is planted, right leg is follow through. There's some really interesting different types of movement. So for me, the way that I think about this is the translation of sport comes from the demands of the sport. So start with what you need to get into. So if you're a baseball player, you need to get in through this spiral mechanic, and you need to get in through a more rotational demand. And if you're throwing, obviously you need to be able to flex at the same time as you're rotating. Whereas if you're hitting, maybe you need more extension with the rotation. And so you're pairing different musculature groups. And so your rehab exercises should really reflect that. So for example, like the Pallof press, or if you're going to do like just a banded rotation, you're probably just in a neutral axial position. That's not necessarily sport specific. You're not really training those synergistic muscles together. So to target a more precise vertebrae, maybe you want you do a more diagonal rotation, and you're going more upward to create the extension with the rotation. Or if you're the opposite way, maybe you're going into a chop. FMS is really big on chop progressions, and so they talk a lot about it's like a half kneeling. I think it's full kneeling, then half kneeling, then it's split stance, and then I think you go into like a tall standing chop. And so there's all these different, basically it's a progression of most stable to least stable, to then progress the difficulty of that exercise. You have to stabilize a lot more the longer you get extended. And this is a concept within jiu-jitsu as well, is the longer you're extended, the more vulnerable you are. So if you've got your arms way out here, you're going to get put into a submission really easily. Whereas if you stay compacted, you're a lot more safe, and it just gives you a lot more stability, but then also it gives them shorter lever arms to be able to pull on this. And so this is the same application when you're looking at things like force production. Questions, comments, stories, anything sport specific that you guys do? I know, Dylan, you were talking about golf.
I like the idea of changing the angle of which you're doing the rotational movement on. I think for golfers, as you start to finish your swing, you go into that more extended position. So I think like a low to high rotation would make sense in that sense.
I would think so. I mean, I don't know. I haven't seen the literature on that. I don't know if that's definitively true, but it makes sense, like logically. I can't think of a downside to training that. Like, what happens if you have a really strong spiral line where you're getting this extension with rotation? I can't think of a downside of that. If anything, you just make them a more versatile, more well-rounded athlete, which I think in golf has been shown to be really beneficial. Not necessarily just like diving in on rotational exercises, but just strengthening the body as a whole is really helpful. There's a lot of research coming out about golfers with lower body force production, and just having good leg strength leads to a lot longer drives, a lot longer shot length. It creates obviously more force, more power. So it's not necessarily all sport specific. Like, some fundamental principles of strength and conditioning carry over to all sports. Having good strength makes you a pretty good athlete for most sports. There's not too many sports where being weak is a benefit.
And I think, to your point, it also decreases risk of injury as well the stronger that you are. So all good things to have.
Generally speaking, yes, but I think that there's certain nuances where strength can be a burden, especially when you're looking at things like range of motion. So where strength is not paired with range of motion and mobility training, and you get just increased stiffness, obviously that's going to decrease your joint range of motion, and then it gets put through that. It exposes you once you have to overextend yourself. For example, in soccer, reaching for a ball, if you've got short hamstrings because you've just strengthened the crap out of them, now you get in a position where you have to stick your leg up and flick to try to reach for that ball. And now that hamstring is being asked to do something that it's never done before. So strength is typically good, but range of motion or body part specific strength is also important. Cool. So for the literature review for this week, there's all kinds of good stuff all over the internet. Just Google anything core stability related, and there's some really good stuff out there. Physiopedia, as per usual, has some pretty good introductory information. If you're interested in just like getting the basics of core stability, RP hypertrophy is more of a gym and strength and conditioning specific core stability, but they talk about core bracing and the differences between active and passive core stability. And then one of my friends, Sean Harris, has a publication that's a scientific journal talking about core stability and its response to the different muscle activation patterns that are in response to suspension training. So stable versus unstable surfaces. He's got another paper that is supposed to be coming out talking about power lifters and core bracing through powerlifting, but it hasn't been published yet. And then for media, Andrew Huberman's got a few really good podcasts. The one with Stuart McGill is one of my favorites. It's a really long podcast, a couple hours, but there's a clip and then there's a long version as well. So the clip, he talks about the spinal anatomy and the pathologies that happen, as well as how to train to prevent them. And then the longer one, they talk through all kinds of different things with like back pain and the basically the onset and the causes of back pain. I'm going to butcher this name, but Pavel Tsatsouline he's got a short that's I think 15, maybe 16 minutes long, talking about how to breathe and train the core strength. And so that's a really good short video if you're interested in learning the breath work and its application to core stability. Especially going back to what we talked about with the diaphragmatic breathing and creating that intra-abdominal pressure. And then Corporis, I'd never heard of this guy before, but he has a YouTube video called The Core Strength Paradox, which talks about basically the intricacies and the misconceptions of core strength. And he breaks it down in quite a bit of detail and nuance that I think is really beneficial if you're looking to kind of challenge yourself or trying to learn kind of the next level of detail of what core strength and core stability really is. So if you're looking for a little bit more detail, a little bit more nuance, then that is where you should go. For this week's publication review, the study I chose was from Stuart McGill. I think that when it comes to anything with the spine, he's got really high quality work, and he's been doing this for, I don't even know how long, 50 years probably, where he's done an inch wide and a mile deep. He's just looked at the spine for years and years and years. And so in this study, it was the effect of short-term isometric training on core stiffness. And so the study design, they took two different populations. One was athletes and one was non-athletes. They took them through a 15-minute isometric program. And then they took their test pre and post for both active and passive core stability. So again, it's kind of that rotation versus anti-rotation argument of are you getting stiffness because your ligaments are thicker? Or are you getting stiffness because your spine is thicker and you're getting more contact between the joints? Or are you getting actual control where the musculature is increasing your stiffness and you're resisting force a lot better? And so they did this looking at a multi-directional approach, which I really like. And so they were measuring for flexion and extension, but then lateral bend was their terminology for lateral flexion, and then the axial twist, which I would call rotation. And so they're really looking at all of the different movements of the spine. And so the three core exercises that they put them through was plank, side plank, and bird dog. And this is gone on to evolve to become the McGill Big Three, if any of you have ever used that before. But this has been generated as like the least invasive exercise that gives you the most bang for your buck without causing a risk of increased pains or injury. So really safe exercises to do, especially early stage. So Sally, for your what was it, L5, S1?
Yeah.
So for them, this would be a good place for them to start. Like there's really low risk in a plank, a side plank, and a bird dog, assuming they have good postural control and they're not getting hypermobility. But if you want to start somewhere, this is where you could potentially start. They, in this case, the researchers had them go through 5 sets of 10 seconds as an activation. So again, they tested them put them through each of these exercises for 5 sets of 10 seconds. And then they retested them, and they were comparing the results between groups. Both groups increased spinal stiffness, and this was both active and passive. There were no significant differences between the groups. What they found were that there were a few outliers, and the two that they noted were an athlete who was a non-responder. And what they found out after interviewing him after the fact was that he had already been doing core stability like daily on his own. And so implementing these really low dose isometrics for him was like nothing. So he didn't get a response to it because his body had already adapted to this kind of a stimulus. Whereas they had a non-athlete who had never done like any kind of isometric core stability exercise ever. And so by giving a really low level of a dosage, he had a super response that kind of boosted that group. But on average, between groups, there were no significant differences. they found that immediate increases suggested that it was an active tissue involvement, because if it were something passive like a ligament or a bone change, it would have taken a lot longer to adapt, and it would have been probably a 6 to 8 week progression where they're starting to note some of those morphological changes. Whereas they saw that it was an immediate increase in spinal stiffness. And so this is suggesting that there's just more control and more postural awareness of the participants, so that they're controlling their muscles better as they're resisting and producing force. And then the last thing that the authors pointed out was that there's implications here for both groups, for athletes and for non-athletes. And they went on to say that for athletes, something simple like this as a pre-activation creates more spinal stiffness, which has two benefits. One, injury reduction, but then also it's increasing the amount of force that they're able to produce at the extremity. So this is a pretty common analogy that I've heard in the rehab space is you can't shoot a cannon out of a canoe. So you need a big boat that's stable to produce more force at the extremity. So having more spinal stiffness should improve performance as well. And then they said from a rehab context, if you're getting non-athlete group who's in a clinic, for example, you get them in and you can increase their spinal stiffness. Now they can go through their activities of daily life. So if they've got to go to work, for example, if they're working in a factory or something like that, you can train them to do these as a pre-activation before doing the physical demands of whatever their job is. But then also in a rehab, like in a rehab clinic, if somebody's coming in with a lot of pain and they're not able to produce force, you can use these exercises to get them to produce force, and then you can get a better outcome from your actual rehab session. Any comments, questions, concerns about that study?
No, but I was looking through because obviously I have the one patient with the A lift, and I was looking through like her protocol, which is kind of like a message that the doctor sent her with exercises and stuff to do, not like a traditional protocol of like, oh, University of here, and this is like some guidelines. And Dylan, to what we were talking earlier, on phase 1, they wanted gentle mobility and preventing deconditioning, but also restricting and avoiding bending and twisting. So they had her do, well, the goal was to have her do pelvic tilts, abdominal bracing, diaphragmatic breathing, which is what we were talking about earlier. But then into phase 2, we moved a little bit more into the McGill 3, big 3. And then we did cat-cow for mobility work. But then in phase 3, we did, this is just going with what the doctor wanted. She was doing the side plank with the McGill Big 3. So in phase 3, we moved into more advanced core stability, which had plank progressions, and then the pull-offs press, which is going to be, again, anti-rotation, as well as doing more stability with the rollout ball, which you're here, you're rolling out, you're kind of like anti-rotation. So going from cat-cow into that, which is how the doctor had it.
Right. And that was pretty consistent with what we had talked about before, right? So starting with like general stability before doing a more dynamic exercise.
Yeah. I don't know. The way that I look at that paper, and it's literally like if I had written down exercises and said phase 1, 2, 3, and 4, and this is what you're gonna do. So it's not like the ones that we usually get for ACL, and like we get like 2 different ones, but it's like almost the same. This one, it's the first time that I've worked with someone with an A lift. But prior to that, she had the athlete had a different surgery that didn't turn out to be good. So then we moved into this one. So
what exactly is an A lift?
It's an anterior lumbar. Oh my God. Wait, let me look it up because I'm just gonna say something that's wrong.
anterior lumbar inferior fracture, maybe?
No, it's God. Anterior lumbar interbody fusion. So basically, you're going from the front, moving everything to the side to work on the spine.
Wow, that sounds pretty invasive.
Yeah. When the athlete told me, I was like, let's look at videos, because I don't know if Matt has, but I had never. And as I'm looking at videos, it says like they make the incision, I want to say it was close to the crest. I think for her, they just went right in the middle and just like move everything to the side. Like you even have a cardiovascular surgeon like just there to be able to move everything so that you can get to the spine, according to the video. I wasn't there for her surgery, so I'm not 100% sure how that one went. But yeah,
It's pretty intense.
really invasive. Yeah.
Wow. What
As most spinal surgeries are.
right.
Yeah.
Yeah.
Well, the other one, which is what's the other one that she had? She had a little bit of the disc removed. I can't remember the name off the top of my head. I've been out of work for a week and a half, so bear with me.
Your brain's gone to mush.
Right. They did that one and unfortunately it didn't work. They wanted to do it again and she was like, no, and then went with the more invasive. But yeah, it's just, yeah. And according to them, it's a 6-month recovery after all that invasive process.
You said she was a basketball player?
Correct.
Wow. You got your work cut out for you then, huh, Sally?
Sure do. Sure do. I don't know. I'm just hoping to be able to bring her back because the hopes and how it was given to her was, we'll do the surgery in 3 to 4 months. You should be able to be back in sports.
Yeah.
And at this time, that has not been the case, but it's a work in progress.
It's a lesson on verbiage and the words that you're using to give messages to the athletes that you work with. Obviously, you can't control what they're told from outside sources, doctors, surgeons, but we tend not to speak in absolutes like you will or you definitely will be back by this time because things happen, individual variability, and so you really have to be careful about how you're saying things, setting realistic expectations, but at the same time, not holding them back too much, not crushing their hopes and dreams, but then also not getting their making them think that everything is sunshine and rainbows.
Correct. It's not a straight line.
Cool. So that wraps up for this week. To go back through kind of what we talked about, the core anatomy is a big piece of any core training program. So whether that's rotation or anti-rotation, flexion, anti-rotation, it all depends on the musculature that you're trying to target. And so there's different components that can be teased out via different movement patterns, whether that's more of a flexion component, more of an extension component, more rotation, whatever it might be. But using that multi-directional application to really get the results that you're trying to get. Producing versus resisting force, again, talking about stability versus dynamic strength. And then the last piece is tying that all into the sport and making it sport specific. So knowing the demands of the athlete and what they need to move through. Obviously, Sally was talking about the different basketball movements going through like a Euro step and knowing the demands of really the forces that they're going to experience when they're going through that movement to then prepare them for that. Because if you don't know what that Euro step feels like or what the forces upon the body are when they're going through that, there's obviously an anti-rotational component on the back side of a Euro step because you're going one direction, but then you're not just continuing to rotate forever. You're bringing it back at some point, or you're stopping there and holding it. But that's an anti-rotation because you're killing the momentum. So knowing what that movement actually looks like and what the forces on the body are is incredibly helpful for designing and progressing rehab. And that should do it for this week. Next week we'll get into the technical elements, and so this is more of the like sport specific skills, things like dribbling, shooting with basketball. In track and field, it'll be sprint mechanics or running efficiency, things like that. But it's really the technical qualities that are helpful on the back end of a rehab that can move the needle in terms of performance. Any last comments? Otherwise, we are good to wrap up.
All
Cool.
good.
Thank you both for being here, and hope to see you next week.